Hello and welcome to the Prostate Health Channel. If this is your first time here, we're really glad to have you with us. This space is dedicated to helping men make informed, confident decisions about their prostate health through trustworthy, science-based information. If you're looking for clear guidance and honest answers, you're in the right place. Today, we're going to talk about a question that comes up very frequently. If I get a prostate biopsy, could it cause the cancer to spread or become more aggressive? It's a very reasonable concern. The idea of disturbing a cancer, of poking at it and maybe making it worse, is something that worries a lot of men. So let's dive deep into this topic and get to the truth based on what the science actually says. When a man is told that his PSA levels are elevated, or that there's something unusual in his prostate exam or MRI, one of the next steps that might be recommended is a prostate biopsy. That's when many men stop and ask themselves, is this really safe? Could the biopsy itself cause problems? Let's first understand what a prostate biopsy is. A biopsy is a procedure where small samples of prostate tissue are removed and examined under a microscope to check for cancer cells. In most cases, this is done using a needle guided by ultrasound or MRI, so the doctor can target specific areas that look suspicious. Years ago, biopsies were often done without imaging guidance, which meant random samples were taken from different parts of the prostate. But today, things are much more advanced. Imaging tools like multiparametric MRI and PSMA PET scans allow doctors to identify suspicious areas and then take precise, targeted samples from those areas. This makes the diagnosis more accurate and reduces unnecessary sampling. But even with these advances, some men are still afraid. They've heard stories. Maybe someone they know said, once they poke it, it spreads. Or maybe they read something online suggesting that biopsies can make things worse. Let's talk about where this idea came from and whether it holds up under scientific scrutiny. There are a few types of cancer, like sarcomas, that are very aggressive and can theoretically spread along the path of a biopsy needle. In those rare cases, doctors might choose not to perform a biopsy because of that risk. But prostate cancer is different. The way it grows and behaves is not the same as those other types of tumors. And studies have not shown that biopsies cause prostate cancer to spread. In fact, the real risk isn't from the biopsy, it's from not knowing what type of cancer you might have. Without a biopsy, it's almost impossible to be sure whether you have prostate cancer, and if you do, how aggressive it is. That's where the Gleason score comes in. When cancer is found in the prostate, the cells are graded on a scale that tells us how aggressive they look under the microscope. This scale is called the Gleason scoring system. A Gleason score of 6, also called grade group 1, means the cancer is very low grade. These cancers grow so slowly that they are extremely unlikely to spread or cause harm. In fact, most men with this type of prostate cancer are placed on active surveillance, meaning they don't need immediate treatment. They're simply monitored over time with regular checkups, PSA tests, and sometimes repeat imaging. On the other hand, if the Gleason score is 7 or higher, especially if it includes Gleason pattern 4 or 5, that means the cancer is more aggressive. So the key point is this: it's not the biopsy that determines whether cancer spreads. It's the nature of the cancer itself. A biopsy doesn't change the biology of the tumor, it just gives us the information we need to decide what to do next. Many men are also curious whether we can skip the biopsy altogether and rely only on imaging like MRI or PET scans. It's a fair question, especially since these scans have improved a lot over the years. And yes, imaging plays a very important role in identifying potential cancer. But it can't give us all the answers. Sometimes, an MRI might show something suspicious that turns out to be benign. Other times, it might miss an aggressive cancer that's hiding in a different part of the prostate. Imaging can help us target biopsies more effectively, but it can't replace them entirely, at least not yet. The ideal situation would be a future where imaging is so accurate that we wouldn't need to do biopsies at all. That would be great. but the technology hasn't reached that level of precision yet. Right now, the biopsy is still the best and most reliable way to confirm whether cancer is present and what type it is. Now let's talk about safety. Another common concern is whether the biopsy procedure itself is safe. The answer is yes, it's generally safe when performed by experienced professionals using modern techniques. Most prostate biopsies are done under local anesthesia, and the whole procedure usually takes only a few minutes. Some men experience minor discomfort, temporary bleeding in the urine or semen, or a little soreness afterward. Infections are rare, especially with the use of antibiotics and newer techniques like the transperineal approach, which avoids passing the needle through the rectum. Overall, serious complications are uncommon. So, let's recap what we've learned. If you've been advised to get a biopsy, it's because your medical team wants to be absolutely sure about what's happening in your prostate. The biopsy will tell them whether there is cancer, and if so, how aggressive it is. This information is vital for deciding whether you need treatment or can simply be monitored safely. There is no strong scientific evidence that a prostate biopsy causes cancer to spread. The risk of spreading cancer through a biopsy is extremely low, and in the case of low-grade prostate cancer, virtually non-existent. What truly matters is the biology of the cancer, not whether a biopsy is performed. In contrast, the risks of skipping a biopsy can be serious. If you delay or avoid the procedure because of fear, you might miss the chance to catch an aggressive cancer early, when it's still treatable. Early detection makes a huge difference in outcomes. And if your biopsy reveals a low-risk cancer, you may be able to avoid treatment altogether and simply monitor the situation over time, avoiding unnecessary side effects from surgery or radiation. At the end of the day, a prostate biopsy is a tool, one that gives you and your medical team the knowledge needed to make the best decisions for your health and your future. We understand that this can be a stressful and confusing time. But you are not alone, and you don't have to make decisions in the dark. That's why we're here, to give you clear, evidence-based answers so you can take control of your health with confidence. If you found this video helpful, please support our work by giving it a like. Don't forget to subscribe to the channel so you don't miss future videos. And if you know someone who could benefit from this information, please share it with them. Thank you for being here. Take care of your health, take care of your prostate, and we'll see you in the next video.